we think we're going to go to a community and change it, we're going to fail. But if we do it with them and make them a part of the change and let them be part of the ideas and to walk with them, that's what it really takes.
What I like better are the assets in the community that we can come and recognize them as healthy and supercharge them. Shine the spotlight on them, give them resources, and connect them to other people.
Hello, everyone. I'm Jaime Wesolowski. I'm the president and CEO of Methodist Healthcare Ministries of South Texas. And it's an honor to be here today with Dan Buettner. Dan Buettner is National Geographic Fellow, award-winning journalist, best-selling author, and the founder of the Blue Zones. So Dan, fantastic being with you today.
The honor's mine, actually.
And we're here today to tell everybody a little bit about how do we create environments that support longer life and healthier life. And we started this almost exactly 2 years ago, right here in Aspen. My team did a great job of somehow getting me 30 minutes with you. And that 30 minutes turned into an hour and a half, because the more you talk about Blue Zones, the more intrigued I got and the better fit it is into the work we do at Methodist Healthcare Ministries. And the more I talked about the Mexican-United States border, the more intrigued you got. So let me start off by asking a few questions. First of all, I love watching you on video back, decades ago. And what really hits me is your curiosity back then, your curiosity to find longevity hotspots. So can you tell us about, flashback a couple of decades ago and tell us about that?
Sure. Well, I first want to say for people listening, the value proposition is about 10 years. The average American could live 10 to 12 more years if they optimize their lifestyle, and I argue that's environment. So I've spent a quarter of a century now trying to find out exactly how do you do that? What does that mean to people? So to your point about the National Geographic project, we set out with a team to, in a sense, reverse engineer longevity. So instead of looking for it in test tubes and in petri dishes, which to date, there's no pill, there's no supplement, there's no stem cell that is shown to stop, reverse, or slow aging. Yet we have verifiable populations around the world who are living 12 to 15 years longer than Americans do in full health. So what are they doing? Why not pay close attention to what these real humans are doing to live longer? And that was the idea. And we found long-lived places, Blue Zones in Sardinia, Okinawa, Japan, Nicoya Peninsula of Costa Rica, among the Seventh-day Adventists in Loma Linda, California, and on the island of Icaria, Greece. And we're still studying those places to this day.
Yeah, tell me a little bit about the learnings that you get from these 5 original Blue Zone places, and then how you take those learnings and help other communities.
Okay, so there's 4 foundational learnings. So first of all, our theory is if you want to eat to live to be 100, you have to know what a centenarian was eating as a little kid and a young adult and middle age and lately. You can't just ask them what they had for breakfast. So my team and I found 155 dietary surveys done in all 5 Blue Zones over the past 100 years. And with Harvard, we averaged them together. And we found that the dietary pattern that most leads to longevity is 90 to 100% whole food and largely plant-based. It doesn't mean you can't eat meat, but the ideal amount of meat probably is about 4 times a month or once a week, more or less.
Yeah.
And but what do people in Blue Zones eat? They're eating whole grains, not a big surprise. Greens, which we often miss. Tubers, sweet potatoes, turns out to be a real superfood. Snacking on nuts, handful of nuts is worth about 2 years. And then beans. If you're eating a cup of beans a day, that's worth about 4 years of life expectancy. And of course, that gets me really excited about the Rio Grande Valley because I don't have to come in with this whole new dietary pattern. I just have to remind them what you and your grandmas have been doing all along is exactly right. That's why Latin Americans who come to America and live longer than Americans.
Yeah. And a lot of times when people think about blue zones, if they don't know too much about it, they get fixated on the diet part of it.
Yes.
But there's so much
You're
more
right.
to it. So please talk about a little bit more of the 9 elements.
Right. So I'm going to talk about 4 of the elements and then an overarching. So whole food, plant-based diet, moving naturally. If we can get a couch potato to just moving 20 minutes a day, it's worth 3 years of life expectancy. Best way to do that is make walkable cities, safe walkable cities. Number 3, give people a sense of purpose. We know that people who know why they wake up in the morning and they're putting their gifts to work, either with their family, their job, or volunteering, they live up to 8 years longer than people who don't. And then the last one, and we've heard this a lot, when I first wrote my book on blue zones, nobody was talking about it, but how we connect.
Yeah.
Having 3 friends who we can have a meaningful conversation with. And in America, it's harder and harder to do, but connecting people in ways where they're likely to be friends.
Yeah.
So those are the 4 things. Now the big insight, the big overarching insight. Most of us know what we should do to live longer, but how do we do it for long enough so it makes a difference?
Mm-hmm.
And that's where this conversation of environment comes in. The problem with individual responsibility and discipline is discipline's like a muscle, and muscles fatigue. We can, all the pressure of our jobs and our kids, and now I got to eat right, and now I got to get exercise. It's hard to remember that, and it's hard to have the cognitive reserve, and it's hard to have the discipline, and we forget, and we wear down, and all of a sudden there's a Snickers bar, and damn it, we're going to eat that thing. The blue zone approach is to set Americans up for success, to look at the entire, we call it life radius, where people live, their schools, their workplace, their grocery stores, their whole city, and use evidence-based ways to shape that environment to set people up for success, so that the healthy choices are easier, cheaper, more accessible, and more delicious. That's what seems to work.
Well, it is kind of ironic that you threw out my favorite candy bar. Now I'm going to be thinking about a Snickers bar all day.
Steaks and Snickers bar. That's with Jamie, those 2 things.
Yeah, do what Jamie says, not what Jamie does, right? But talk to me also about communities, because I remember so vividly when you and I were talking 2 years ago, and you said, Jamie, I'm glad that you're passionate about this after this conversation, but if it's just you wanting to do it, don't do it. You got to have the communities, you got to have the buy-in of the cities, the municipalities, the employers, etc. So talk to me about how important it is for communities to really want this.
If you're going to try to pursue longevity on your own as an individual, you'll probably fail. And I can't find any evidence that shows the individual pursuit of longevity works. I can show you a very deep literature on communities who work together who live longer. So at the end of the day, it requires, well, first of all, your immediate community, curating your immediate 3 or 4 friends whose idea of recreation is pickleball or golf or walking or gardening, friends who will push you intellectually, friends who care about you on a bad day. And it's not a bad idea to have a vegan or a vegetarian in your immediate. Community is also thought of as our neighborhood. There are some neighborhoods in America where people, say in Kentucky, for example, where life expectancy is 22 years lower than another zip code or another neighborhood in Colorado or New Mexico. So why not look at what's going on in those high life expectancy zip codes and mimic that? That's a community intervention. And that, again, is connecting neighbors, safety watches, community gardens, potlucks, block parties. These are things that bring people together. And it's not necessarily bringing people together and saying, okay, now you guys have to do all these longevity things. Just the act of organizing people around healthy things. A dinner party, a garden, a walking club, safety for the neighborhood. That is not only lasting, but the evidence is very deep that it will help you live longer.
Yeah. At Methodist Healthcare Ministries, we do a lot of work in communities. And what we have found over the years is if we think we're going to go to a community and change it, we're going to fail. But if we do it with them, and make them a part of the change and let them be part of the ideas and to walk with them. That's what it really takes. And I think it's the same thing with Blue Zones. So we walk with communities. Communities have the solutions, and if you let them participate and be part of it, it really is magical. So that's something we've learned. And as we're working together on Blue Zones in the Rio Grande Valley, I think that's key. And I think we're about to have 7 different cities in the Rio Grande Valley that are extremely excited about it, that want to be part of it. I think they're all in. It's going to be transformative. I'm excited about it.
Well, first of all, I want to salute you because I know this organization grew out of hospitals. We need hospitals in America. They help sick people. They treat sick people. But the healthcare systems around the world that produce longevity are also worried about people before they end up in the hospital. Mm-hmm. And your organization does better than anybody else I know at trying to bring the health outside the walls of the hospital and bring it to the community. Number one. Number two, as you know, with Blue Zones, we don't come to the city and say, we're going to make you healthier. We come and we have a menu and we say, here are ways that have worked elsewhere. Is this right for you? And if they say yes, we work there. And if they say no, there's 475 other communities that would like us to work there. So we can only be successful in communities that want us. But then to your point, I don't really love this term underserved. I don't think people should be thought about as needing to be served. What I like better are the assets in the community that we can come and recognize them as healthy and supercharge them. Yeah. Shine the spotlight on them, give them resources, and connect them to other people. And that's what I think you guys are doing so well. And that is more or less how Blue Zones works.
Yeah. Well, thank you for that compliment to MHM. That means a lot coming from you. And my next question really is, and that's something I'm learning right now because we're going through the assessment phase, right? So how do you at Blue Zones go through and assess a city or a community to see if they're ready and if they're willing to go through this and make the changes to become a Blue Zones area?
So I'm gonna roll back the clock a little bit. So when in the 80s and 90s, when you and I were at the university, the obesity rate was 1/3 of what it is today, and about 1/7 as many people were suffering from type 2 diabetes. Was that because there were better diets back then, or better GLP-1s, or better stem cells? No. What was different back then? Well, first of all, in the 80s, there were about 1/20th as many fast food restaurants. People didn't go breakfast, lunch, and dinner to a fast food restaurant. It was a rare treat. Mm-hmm. Number two, we drove about 1/3 as many miles in our cars as we do today. Cars are a good thing. We need cars, but there's too many of them. And building our cities for walkability are going to get people out on their feet, moving more. So the key to setting up a community for health is getting them out from behind their steering wheels onto their feet. It's giving them a food environment where you're not taking away their choices, but you're making the healthy choice cheaper, and the most important thing is more delicious than the other. One of the big discoveries we made with Blue Zones and Blue Zones Kitchen is that if you take the same culinary genius that we use to make pork belly taste delicious and unleash that on healthy foods, beans and grains and the right vegetables and the right sauce and the right smell, you can make plant-based whole food taste explosively delicious, mm-hmm. and people will leave the meaty, cheesy, processed food behind. Yeah. It just requires thinking differently at scale. Yeah.
I have to tell you, Lori and I, my wife, we cheat once in a while because sometimes you just don't feel like cooking at the end of a long day, and so we have a freezer full of Blue Zones meals that
Blue
are
Zones kitchen meals. Thank you very much.
And they're great, and we really enjoy those, and that makes the healthy lifestyle the easy lifestyle. Sometimes when you just don't feel like cooking one night, right?
And more delicious, we like to
think.
And
they are delicious.
We spent a whole year with Yale scientists to make those whole plant-based foods taste maniacally delicious. And when you spend a year, you get it right. I rejected 26. For every one meal we have, I rejected 27 other recipes.
They are delicious. So, Dan, I want to thank you for this transformational partnership.
Thank you very much.
I'm so excited to be working with you. And I look forward to someday when we look back and see what we did for the Rio Grande Valley, that Mexico-U.S. border, and how we have changed it.
We're going to do a lot. And just to set up expectation, the cost of doing nothing is enormous. We're spending $5 trillion a year. It's going to bankrupt our economy. 75% of us are overweight or obese. It does not have to be that way. And the fact that we're locking arms for the next 4 or 5 years to make a difference, you're going to be proud. I'm going to be proud. And everybody else there, I think, is going to be happier.
Absolutely. Absolutely. So, thank you for being with us today. If you'd like to learn more about Blue Zones, or if you'd like to learn more about Methodist Healthcare Ministries and the work that we are doing in communities, please click into the link in this caption. Thank you very much.